I would just say stay true to yourself, stay true to your application. Just because it's not the same as your cohort doesn't mean that you're not a great applicant.
Hi, everyone. It's Vrushangi Shaw with the Fellowship Review through the American Journal of Healthcare Strategy. Today, I am so excited to be joined by Rasika Mukkamala. Thanks for coming on tonight, Rasika.
Yeah, thanks for having me.
Let's get right into it. Why don't you go ahead and give our listeners a brief overview on who you are, where you're from, and where you're doing your fellowship?
I'm Rasika Mukkamala. I'm originally from the Denver suburbs. I was born and raised there, and then I moved to Omaha, Nebraska to do my undergrad studies at Creighton University. I got a bachelor's degree of science in healthcare administration and policy with minors in public health and biology. And then I moved to Iowa City, Iowa to complete my master in health administration, where I recently graduated this past May. And while I was at the University of Iowa, I also completed a graduate internship with the community clinics. And so, really passionate about ambulatory care and primary care and access to care as well. And I moved back to Omaha, Nebraska, where I am currently in my third month as a fellow in the operations track at CommonSpirit Health.
That's incredible. So you've moved around quite a bit, but in the Midwest now, which is exciting. And I think it's so incredible, that Creighton had an undergraduate healthcare administration track. That's not very common, actually. Yeah, and similarly, also another Jesuit institution not that far from Creighton. I went to SLU and was very fortunate that there was a healthcare administration track. So I love that you found that. And in talking to you, I learned before this that you have a plethora and incredible internship experience. And so I really want to have our listeners, kind of listen in on the two that, I feel like would benefit them a ton and kind of show the diversity in what interns can do while they're on either an undergraduate or graduate healthcare administration track. So let's start with the internship role that you had with the women's service line as well as infection control with CHI. Could you tell our listeners about that?
Yeah. So at Creighton, for our healthcare administration program, you need to complete an internship in order to graduate. That's part of the requirements. And so I chose to do my internship at CHI Health, which is now part of CommonSpirit. So I started in the women's service line, and my preceptor, who's still works with me at CommonSpirit now, I worked on at the time. We were really just learning about CommonSpirit, kind of the trickle-down effects to CHI. They were still kind of separate entities, but they were together at the time. So just learning kind of those dynamics, as well as this was right during the pandemic. So just better understanding, PPE for staff. And that was at the time when COVID vaccines were coming out. So learning about that and how do we educate our patients, how do we educate our employees on what is best for the community. And so I really just learned a lot about women's health and passionate about women's health. Access to care is something that I really am passionate about. So just learning about both inpatient and outpatient, what different opportunities there are to get involved. And so I spent time there, and then I actually took an epidemiology class, and that was part of the requirement for my public health minor at the time. But I really just didn't know what I wanted to do. And so part of me was like, okay, maybe I want to be an infection preventionist when I grow up. Like, I wasn't sure if I wanted to do an MHA, an MBA, or an MPH. So I was kind of like, okay, I did my women's service line work where I kind of like filled out the MHA bucket. Let me do some MPH work and see if I want to be infection preventionist. And at the time, my preceptor was the epidemiology professor at Creighton, and she and I were still super close. But at the time, they were getting ready for a joint commission visit. And so it was just a lot of preparation and getting to know all the standards and doing mock surveys and all those things. And I think after I left that internship, I really was like, wow, I have a real appreciation for this work. But at the same time, I feel like my talents lie more on the business and the administration side. So I did choose to pursue at MHA. But I do think that all of the experiences that I've had prior to my time at I spent time researching. I did cancer research, I did research on idiopathic pulmonary fibrosis, and all of those experiences have really led me to where I am today. And I would urge listeners that just because something might not be your top choice, or you might not be sure how this will lead into your path, I do think that now being in a setting where I have like academics as well as hospitals, there's just so much going on. There's research, there's academics. With our partnership with Creighton, I just have such an appreciation for research because I myself was on the bench, a couple years ago doing all the Western blots and all those things. And so sometimes when you're in it, you don't have as much appreciation for it. But then when you step back and you look at how much of an impact, research, healthcare, all these things come together, it really is just great to kind of hear and see all the impacts that healthcare has. So I would say like all my internships have kind of led me to where I am today, and I wouldn't be where I am without them.
Yeah, absolutely. And what incredible experiences through all of your internships, especially with infection control. I think people underestimate just how important
Oh,
that
yeah.
is, especially in a hospital setting. And so it's really cool that you got that experience. And another incredible health system that you were able to be a part of was UC Health, where you were an administrative intern. So
Yeah.
tell our listeners about that experience.
Sure. So I completed a administrative internship at my hometown hospital actually last summer. So it was 12 weeks and it was a rotational based internship. So I spent time in all the different service lines, support services, and I really just got to know how a community hospital operates. And it really gave me appreciation for how much a community hospital really can do. I think it's easy to kind of get in a mindset of, people want to be at a flagship hospital, they want to be at the AMC. That's where people want to be. But I think being at a community hospital just really made me appreciate, what kinds of things can be offloaded from an academic medical center because not everything needs to be done there. And, they provide great quality of care, they have great quality initiatives, they have such great staff, and their patient experience is amazing. And, sometimes you just have to think about where do patients want to see care. And so, really, my internship, I spent a lot of time working on projects. One of the projects that I worked on at the time was streamlining their new employee orientation. So the hospital that I worked at was fairly new. I believe it was 3 or 4 years old at the time. And they had undergone an original onboarding process for their new employees, but after the pandemic, they really wanted to revamp it. And so that was one of the projects that I took, and it just gave me a real appreciation for human resources. And I think that sometimes people they disregard human resources as a MHA because people think you have to have a master's degree in human resources or an undergrad in human resources. But it just gave me a real interest for that. And I think about how, I'm not a clinician by any means, but as an administrator, I take care of clinicians, and human resources is just one part of that. So I think just it gave me such appreciation for caring for clinicians, caring for staff, and employee retention, and especially workforce shortages. That's probably like the biggest buzzword in healthcare. So just appreciating that and learning personnel issues and all these things. How do we really focus on patient safety, patient care, while also focusing on employee satisfaction? And that's just something that I really enjoyed while I was at my internship.
Yeah, absolutely. Thank you for sharing. A couple of things really stood out to me when you were talking. First, I could not agree more about the value of community hospitals. I also did an internship at a
Yeah,
community hospital, and hands down, it was one of the best career experiences for me. I
I
think
totally agree.
there's a homey feel to
Yes,
community
yes.
hospitals. So I did love that a lot. And I think, another thing that you said is to the HR piece. I think one of my dear mentors right now is in HR, and
Mhm.
just knowing all the work her and her team put in to help our health system works smoothly and
Right.
put out all the fires. I think there is a lot more credit that needs to be given.
Yeah.
HR is more than just hiring,
Yeah.
assisting in the hiring process. So I appreciate you kind of highlighting that. And of course, the UC Health is such an incredible health
Yeah.
system. I have interfaced with a lot of leaders from that health system. So I'm so glad you had that experience.
Yeah.
Before we transition specifically to Common Spirits Fellowship, I want I would love for you to share, why did you pick a fellowship? There's a lot of routes you could have taken post MHA. So what really drew your attention to go through the fellowship process?
Yeah, that's a great question. So, I would say I knew pretty early that I wanted to complete a fellowship. So, because I went through Creighton's HAT program, Health Administration, they actually did multiple panels and conversations in my undergrad about fellowships because a lot of people from my program did transition to MHA or MBA program. So it's kind of like a natural progression. And so I
Right.
became interested in a fellowship program pretty much before I decided that I wanted to do an MHA. So I just heard from people's experiences saying, it was the best way for them to kind of connect the real world experience to the books that we learn. And I knew that, I went straight from my undergrad to grad school. I'm often the youngest in the room, and it is nice for me to have this time where I'm still learning, but I'm also doing projects and having a lot of autonomy. But I just really wanted this extra experience to really solidify my interests. I think it's really I have a path that I kind of want to take, and I can get into that more during when we talk about the fellowship. But I think the fellowship is a great way for people who know what they want to do or people that don't know what they want to do to explore. And I'm the kind of person that I really like everything. So it's almost easier for me to say, I don't like this, I don't like that. And so I thought a fellowship would be the perfect avenue for me to kind of test the waters with different disciplines and see, where do my passions lie? What excites me when I go to work? And what doesn't excite me? What can I maybe
Yeah.
hand off to the subject matter experts and say, you're an expert on this, I will pass on that. So I really knew from early on that I wanted to do a fellowship. And I also knew that I wanted a balance of projects and rotations. I would say I'm a pretty structured person. And so I wanted the flexibility of being able to tailor things to my interest, but
Mhm.
also having set objectives that I need to achieve because I do better when I have like tasks and checklists
Yeah.
and things. And so I kind of wanted the best of both worlds in a sense. And I do feel like that is something that I would urge everyone that's listening, if you're interested in a fellowship, to really consider. Are you looking for something that's strictly rotational? Are you looking for something that's strictly project? Are you looking for something that is a mix? Are you looking for a 1 year? Are you looking for a 2 year? There's a lot of discernment that I think goes into preparing for a fellowship. So I would urge listeners, if you're considering a fellowship, make sure you do that thinking before the fellowship cycle starts so that you kind of have a better idea of what you want to apply to when you start applying.
Yeah, absolutely. And that's definitely a similarity you and I have as well, because I also decided I was going to do a fellowship before I really even applied to grad school, or I was in undergrad and
Yeah.
just transitioned to health management. So I totally relate to that as well. And so digging more into the fellowship cycle itself, how was that process for you? Was it intense? Preparing for interviews, what was that like, and what ultimately led you to pick Common Spirit?
Sure. I would say if you asked me a year ago when I was in the cycle, I would tell you that it was intense. Looking back now, I actually feel like I did all the right things at the right time, and I don't actually feel that it was as intense as maybe it could have been. I will say so going into it, I mean, I knew I wanted to do a fellowship and I knew that I wanted to I kind of had geographical preferences. So I was kind of thinking like I wanted to stay either in Omaha or I wanted to go back home to Colorado or maybe potentially be on the East Coast or kind of wherever I had family located. I was kind of
Okay.
looking at that. And so my first thing that I did was I made a list of all the places that I wanted to apply to, and I had that ready before I left for my internship at UC Health. And every day when I would get home from my internship, I would just keep thinking to myself, if I got an offer from any of these places, would I go there?
Mm.
And the minute I said no, I took it off my list, because one thing with the fellowship a season, and you know this, but it's, the timelines are tough, and sometimes you get an offer and you have 48 hours to decide. And so it really is important for you to want to say yes to any of the programs that could offer you admission. And so that
Mhm.
was something that I really considered long and hard. And as, okay, if I get an offer, am I going to take it? Yes. If no, I'm not going to apply there. And so
Yeah.
I really followed that rule true and hard. And I would urge everyone that's applying to fellowships to do that same thing, because it really made my decision pretty easy when I got to the end. But during the fellowship cycle, so I applied to, I believe, 8 or 9 fellowships, and I submitted all my applications before I got back to school. So that was it was tough on the summer, but then when I got back, it was kind of peaceful for a couple weeks.
Yeah.
So I would urge people to apply early, just because, then it's not on you anymore. It's on the reviewers. So that was very nice. And, I created kind of like a playbook on OneNote at the time, just kind of talking about people that I had talked to. If I had talked to their previous fellow, what did we talk about? What kind of projects did they discuss? If I found any information from their website, if there was any alumni. So I had all of that on my OneNote, and that was kind of how I prepared for interviews, just really looking at, the mission, the vision, the values of the organization, as well as, are there any community initiatives that I'm interested in? Do I have a specific interest or track that I'm looking at? And so all of those things combined, I would say, just really made my application process easy, because I had kind of done a lot of that legwork prior to submitting the application. So then when I had the interview, I was just kind of referencing my documents as well as what I had done before. So I would say the preparation itself wasn't that intense, because I had front loaded myself.
Yeah.
Um, but I would say, looking back, it's hard to believe that that was a year ago, because I feel like when I was in it, it really did feel like the end of the world. Like every day I was just like, hey, is today the day that I get an offer and I get a job and I don't have to worry anymore?
Yeah.
And looking back now, it is just so hard to believe that it is a year later and I'm in my fellowship, because a year ago I was like freaking out about like which first round I was going to go to, because I had so many overlapping times. And, it's just so crazy how much in one year your life can really be so different.
Yeah, absolutely. I appreciate you sharing all this. And so now, kind of diving into Common Spirit,
Yeah.
tell our listeners first kind of the structure, how many fellows there are, what's mentorship like in the fellowship? Is it 1 year, 2 year? Is it project based, rotational, and kind of just that general overview, if you could provide for this specific fellowship that you're in?
Yeah, so Common Spirit has, I believe, 12 fellows across the system. We have 3 tracks. We have the operations track, which is the track that I'm on. We have an IT track, and we have a mission track. So we have different fellows that correspond to those different tracks. We also have fellows across the country. So we have some in our California market, the central region, which is where I'm located, where we are split between the Phoenix, Arizona area and the Omaha area. We have some people in Texas, Kentucky, I believe, and then maybe a couple others. But so I will provide a disclaimer that while we do have a generalized track, I do think that every fellow's experience is different, even within the same organization. So if someone's looking to apply, I urge you to ask the person that is in the market that you're interested in, just because I think there is differences in projects and other things. So generally for Common Spirit Fellows, it is an 18-month rotational and project-based fellowship. So 6 months hospital rotation, 6 months ambulatory rotation, and then 6 months of an interim management role within either discipline. Sometimes people will do an elective rotation if there's something that they're passionate about. I believe the IT and the mission tracks are maybe a little bit different, but the operations track generally follows those rotations. Um, I am focused more on the ambulatory side. I mentioned in my intro that that is kind of what I'm passionate about, what I'm interested in. So I am primarily on the ambulatory side. So even though Common Spirit kind of has a set like 666, I am kind of more spending time on the ambulatory side. And I will do a hospital rotation, but I think I'll focus it more on hospital based clinics. But I am also spending time at the market level. So we have multiple levels of governance within CommonSpirit. So we have CommonSpirit National, and then we have the region, which comprises multiple markets, and then we have the market, and then we have local. So, like, if you have a clinic, that's more local level. So I've really been able to kind of get exposure to all of these different levels and learn about different projects and different rotations within those different governance models.
Yeah, that's incredible. And so to the mentorship piece, who is kind of your preceptor? What is mentorship like with the other higher leaders, executive leaders within your location?
Sure. So, Common Spirits Fellowship, there is an executive champion and a preceptor, and so I believe the executive champion stays the same for the whole year. At least mine will. And then the preceptor may change based on which rotation you're in. So you may have a hospital rotation preceptor and then an ambulatory rotation preceptor. But because I'm kind of primarily focusing on the ambulatory side, I'll kind of have one. So my executive champion, Dr. Randy Pritza, he is the system senior vice president for the physician enterprise in Omaha. So he actually oversees Nebraska, Iowa, North Dakota, and Minnesota as part of
Wow,
his purview. And then my preceptor is the vice president of operations and development,
nice.
Julie Gernetsky, and she also oversees those four states as well. So I felt very supported. There are so many directors that I work with on a day to day basis that provide, I would say, more peer to peer support. That I do have a co-fellow. Shout out Tanner Bosworth if you're listening. He is my co-fellow. He is on. He has a separate preceptor, but we work together. We see each other all the time. So I would say we have peer-to-peer support in that sense, and with all of the other fellows in Common Spirit, we all kind of have peer-to-peer support. But when it comes to project support or just day-to-day support, I would say I really lean into a lot of the directors that I work with, and I'm hybrid, but mostly in person, and most of my team is as well, and so I spend a lot of time, like building community with my coworkers and just better understanding like how they got to where they are, and so it's really fun just being in person. I really enjoy the camaraderie. I feel like it definitely makes my day brighter. But I have a lot of mentorship from the directors. I meet with them. I meet with two of them once, like every other week, and they really give me career advice and kind of talk through my projects and kind of help me think of more about logistics, I would say. And then I meet with my preceptor once a week, but her office is right next to my office, so I talk to her every day. And
Yeah.
then my executive champion and I see him all the time, but we have monthly meetings, and so I really do feel very supported. I feel like everyone ultimately wants what's best for me, and they've had a lot of fellows at the Legacy CHI, so CHI and Dignity Forum to become Common Spirit in 2019. But the Legacy CHI in the Midwest has had fellows for over 20 years. And so everyone in the Omaha market, at least, is very aware of what a fellow is. And so it's really great because even before I got to Common Spirit, my calendar was full of invites because people knew that I was coming. And so it was just really welcoming. And there's a lot of hospital leaders that I work with as well that I've been able to work with. And our previous fellows, we have quite a network of fellows that are local to Omaha, but also those who are not local to Omaha and they're Common Spirit fellows. We have a pretty vast network of alumni. And so getting to talk to them, hearing about their experiences has been very positive. So I would say I have a plethora of mentors, and sometimes it is nice to kind of go to one person for one thing and one person for a different thing. So I really have enjoyed my experience so far.
That is so incredible to hear. I think one of the big reasons people do fellowships is for the mentorship aspect.
Yeah.
And so I always like to ask my guests about their experience. And I know we chatted about this a little bit before, and you're fairly new in your fellowship, but it's so good to hear that like even before you started, they were welcoming you and
Oh,
having
yeah.
you on board. So I'm so happy to hear that.
Yeah.
Kind of, the last question I always love to ask all my guests, because I think having gone through the fellowship cycle, it's insight that you can provide. So looking back on, what this journey was like for you, of course, you successfully secured a fellowship. To our listeners, what would you want them to know? What is advice that you wish you had knew, or even something you would do differently if, you got to go back and redo the fellowship application cycle?
Yeah, this is a great question. I would say I have a couple things. So, the first thing I would say is while you're in grad school, don't do something just because you think it would look good on a fellowship application. I would say the things that made me stand out in my application were things that I did because I thought they would be fun. So, an
Yeah.
example was the University of Iowa, we had a podcast, it was called From the Front Row, and I just joined it because I had never been on a podcast before. I wanted to kind of try out a different way of public speaking, and I just needed another extracurricular activity that was going to be low stress. And so I just joined the podcast for fun, and it turned into one of the most amazing things that I could have done while I was at Iowa. I interviewed guests from across the world, and really just got to put my spin on healthcare policy, healthcare ethics, all these things. And that was one of the most asked questions that I got in my interviews was, oh, who did you interview? What was your favorite episode that you did? What has been like one lesson that you've learned from the podcast? So I would say don't do something just for the resume. Do it because you want to gain something out of it, whether that's you want to gain public speaking experience, you want to have fun, you want to enjoy yourself, you want to like step out of your comfort zone. I would say that would be my first piece of advice to our listeners, because I know it's really easy to fall into the trap of, okay, I'm going to do A, B, C, and D because the person that got the fellowship that I want last year did exactly these things. I want to have the exact same resume. But really, that's not what's going to make you a well-rounded applicant. It's what makes you different is going to make you a standout candidate. So that would be the first thing that I would recommend. The second thing I already kind of said previously, but I would say when you are looking at making a list of fellowships to apply to, really take time to discern, can I live here? Do I want to live here? Do I want to live here long term? And if I got offered this over any of the other programs, would I say yes? Because oftentimes I think it's really easy to say, okay, this is my number one, this is my number two, this is my number three. But the fellowship cycle, there are quick turnaround times, and sometimes your number one might be the following week, and you have an offer from your like number two or number three, and you have 48 hours to decide. And so for me, that was kind of the mentality I took was, okay, I'm going to take whichever offer I get, I'm going to take it because I've already narrowed down my list to XYZ. And it is hard to turn down fellowships, but ultimately, everyone has to do what's best for them. And so just making sure that you have a great list and you've talked through with your mentors, is this somewhere that I can see myself living? Is this somewhere where I want to work? Do I know people there that can vouch for it? So those are all different things that I would suggest. But the last thing that I would suggest, and I got this advice and I didn't really listen, so I don't know how helpful it will be, but when you're in it, it's really easy to get down on yourself, especially, when you're not getting interviews, or someone else in your cohort is getting an interview for your top choice and you haven't heard back. It's really easy to listen to that noise and get really
Mhm.
bogged down by this person's going here, this person's going here. I don't even have an interview. It's really easy to get down on yourself. And I would just say, stay true to yourself, stay true to your application. Just because it's not the same as your cohort doesn't mean that you're not a great applicant. Stay true to who you are and stay true to your application and know your worth, because you wrote your application. You have all these amazing things to share, and it is really easy to get down on yourself. But I would say, find your true north and follow it, because that is ultimately what is going to help you be a great healthcare administrator one day. And I would also say, be open and be willing to do some things that you might not think are traditional healthcare administrator things. For example, in my fellowship currently, I'm working in the business development area, so building new clinics and renovating clinics, and it is the most fun I've had in a long time. I love going to work. I love working on my business development projects. And you might not think traditionally, oh, that's like a healthcare administration path, but I would just
Mhm.
say be open, because there's so many different avenues out there and you're not going to know unless you say yes. So have a true north in mind, but be willing to pivot. And I hope that everyone has a great fellowship season if they are choosing to apply.
That is incredible advice. And I just echo, location does matter. I think be
Yes.
intentional about where you're going to go because ultimately you're going to live there. But
Right.
also, you're so right. Your advice is very practical. If you have an offer from number three, but you're still waiting on number one, it's something to think about because,
Yeah.
the cycle itself is also very competitive. And so,
And it's very short too. Like from August to like mid-October, it is every day, checking that email, making sure that you didn't miss any invites. But it's a month and a half, and it is a hard time, but it is so short. One week you could have 5 interviews and the next week you could have a job offer. So it's so short. And so it's really hard people ask me all the time, they're like, "Oh, well, would you have done something different?" I'm no. I think you have to make the choice that's best for you, and I'm really grateful for the opportunities that I had, and I think every interview, made me realize what I want in a fellowship. And then ultimately when I decided to come to Common Spirit, that was a culmination of, you know, me getting an offer, but also realizing that it was important to me to have, rotation and projects. So I would say I totally agree with you. It's such a short process, stressful, but it all works out in the end.
yes, and on that note, I think that's the best way to kind of wrap up, this incredible conversation. It does all work out in the end, and it definitely did in your case. But
Yeah.
Rasika, thank you so much for joining and giving our listeners such incredible advice. It was such a pleasure chatting with you tonight.
Yeah, thank you so much for having me.